Hi there, Andrew Zang, Physical Therapy here, and I want to continue the discussion that I started the other day regarding neck pain. And today it's why isn't it getting any better? And this is a very common question that I field from individuals who have suffered with neck pain for weeks or even months, and in a very few cases, sometimes even years. People just can't get rid of what they're dealing with. And my first question to them is always, well, what have you tried? And a lot of the responses, heat or ice, maybe some kind of Advil or Tylenol or something like that are very common. I'll often hear people say stretching, and then I have them show me what stretching they're doing. Sometimes they are doing something that could be beneficial, and more often than not, what they're doing just, it's not helping because it's not the right thing for them. So then another question is, well, who have you seen about this issue? I've seen my primary care doctor, I've seen an orthopedic, I've had imaging. They told me there's arthritis, there's nothing can be done. Meanwhile, this person's only about 35 to 45, so they have a lot of years left to live. And so just living with it really isn't an option, and it shouldn't ever be put forth in that manner. To get to the end, everybody keeps coming back to why isn't it getting better? Why isn't it getting better? Well, again, the right thing for that person obviously hasn't been discovered and or implemented. Now, be this they just didn't get to the right provider, or be it the provider didn't give the right thing for the patient, that I can't always speak to. But what I tell everybody is, well, let's get in there, let's see how you move. Let's see what's difficult. Let's see if we can find something that's going to be relieving just a little bit. If we can find something that changes it just a little bit, maybe your body, your neck in this case, needs just more of it to undo all the stress and strain that had built up over weeks, months, or even years. So usually as we progress through the examination, we find that they have some motion limitation in their neck. Pretty common. Maybe they're stiff or tight somewhere in their neck or in their upper back. Again, very common. And then we'll do some treatment. And then we'll get back up and we'll retest that motion that was restricted or stiff. And when it changes, the person, begins to have this epiphany. Oh, so if I work on my mobility, if I then do some, maybe it's strengthening or maybe it's stretching for that individual person, whatever it is, maybe what we just did here on your treatment table is going to help me in the long run? And the answer is probably yes. So what people need to understand is that when you're working with a provider and a change has been made, what can you do at home that's going to help it carry over? Because that's something that is often missing. We make a great, what I call within session change. So while you're with me or while you're with any provider, a positive change happens in terms of your motion or your pain or whatnot. But then you go home and maybe do the exercises. Half the time people don't do what they're advised to do, and then they fall back right where they were. Called regression to the mean. Very, very common, and something we battle every single day in our profession. So what we have to do, again, is teach people how to get the carryover. And that's why people aren't getting any better. Or one of the reasons. So number one reason people don't get better is they didn't see the right provider for them. And just because you didn't have success with one provider doesn't mean another person can't help you. So if you're out there struggling and need a second opinion, then go get that second opinion. Because maybe that second person can help you. And they're going to use the information that that first provider did, and maybe it helped a little bit or maybe it didn't. And that gives them the next piece of puzzle to know that's not what I need to do. I need to go a different avenue. Okay, so just because you didn't get better doesn't mean that you can't. It just means you haven't found the right provider that's given you the right direction just yet. So don't give up. Don't rely on injections and pills. Please don't, go the route of surgery except in the most extreme circumstances. And hopefully any orthopedic you saw would tell you exactly the same, but unfortunately they don't. So, again, why aren't you getting better? There's obviously a piece missing. So go find that piece. If you don't know where to find that piece, then put a comment in the box below. Tell me what you're struggling with, and I will do my best to answer your questions and get you pointed in a positive direction, because that's what it's all about. Even if it's not with me, I want to help get you to a person who's going to help you to feel better, so you don't have to live more days, more weeks, months with neck pain. It just isn't necessary. So again, if you have any questions, let me know. Otherwise, have a very nice day.